welcome to my lovely panelists. We're so happy to have you here on the Cleft Con stage. We're just going to dive right in. Talking about Cleft can be tricky. It can be very tricky. And the words that we use are very important. Last night, for many of you who might have went to the welcome reception, Delilah did a poem about the words and the words that we use. And so for all three of you, why do you think the language we use when talking about cleft and craniofacial differences matter, especially in healthcare and advocacy spaces? And any one of you can jump in first.
I guess I can jump in first. Language is how we see ourselves, and words matter. They have a significant impact on the narrative that we tell ourselves. They can either tear us up, tear us down, or bring us up. And so it helps us to feel seen as a person when we use first-person language, such as person with a cleft. And so also what I've learned, especially from my experience, is that the language we use can either reinforce the stigma or it can totally tear it down. It can change the narrative of our stories. We talked a lot, and especially in our discussion panel about mental health, of sharing your story. By sharing your story in that positive first-person language, it not only helps you heal, it teaches society of what language to use about yourself.
Absolutely. Morgan?
Yeah, I mean, I completely agree with everything Christine just said. Words matter, and it actually changes your brain structure. So doing positive affirmations, things like that, changing that, having that mindset shift really changes the way you think. Mm-hmm. So, yeah.
Yeah, Marley?
First and foremost, I want to say to all of you, I know everyone in this room is here because you care about someone's health and well-being, the health of your child, the health of your loved one, the health of yourself. And talking about word choices is a very important conversation to have. It's not about shame or guilt. Words are powerful tools, and they can frame a narrative, stir emotions, influence beliefs, even change public behavior. And we've heard a lot of things today that have sparked emotion in us, and there's been tears in the room. And, you know, the words that we're hearing and words that we hear in the medical community do the same thing. And children are not born othered. We're not born different. We're told we're different. And we're told by, oftentimes, the medical community that we're different. And we really do need to consider the word choices that are used around developing children. Words are teaching stigma, and the medical community often teaches our parents who are new to this game what language is acceptable to use about us and around us, and it's okay to correct that language. I think Steph Hines did it. Her mother did a perfect job earlier with the example of the dentist and pulling him around the corner and saying, "Hey, it's not her fault this is happening. You know, change your tone and change your language around my child." And I think those things are very important, and it's okay to do that.
Excellent. I totally agree. You can always say, I don't want to be addressed in that way. You have the power to use your words to help others find the correct words when addressing you, especially when talking about cleft and our cleft journeys. And so for Marley and for Christine, from your experience, what are some examples of outdated or harmful language that you've encountered, and how have you responded when you heard it?
Well, I think Marley's probably going to agree and have the same words that I've heard, but I've heard words like birth defect, I've heard the H word, and I'm not going to repeat it because I don't want to set everybody off, but it's a very derogatory word. I've heard, I was called monkey face. I was asked if my mother was kicked in the stomach when she was pregnant. But more importantly, some of the painful words also came from doctors. Mm-hmm. They said, well, we're going to fix you up. And the minute they said that, it implied and made me think, well, I'm broken and I need to be fixed. And I carried that with me for my whole life. The other word that they said is that we're going to make you look like a model. No offense to, I don't know where she is right now, but all the models out there, I didn't want to be a model. I just wanted to be normal. Mm-hmm. And Like Linda said earlier, I didn't even know what normal was. Now I know normal is just a setting on the dryer.
Yes.
Which that's my new favorite. Thanks, Linda.
Yeah.
But I just wanted to be able to eat and breathe and talk normally, or talk functionally, for lack of a better word.
Yeah,
And so when the doctors told me, oh, we're going to make you look beautiful, again, it was that stigma that, oh, I'm not beautiful already. And so I always tell doctors now to avoid using that language. I tell any medical provider to avoid that language because even today it makes you stop and think, well, why are you going to make me look beautiful if I'm not already beautiful? So
Absolutely.
I'm Molly, go ahead and take over.
Marley, you have anything to add to that?
Yeah. Words shape a child's identity and self-image. There's three things. I just read in a book called Face It. The author is Dr. James Partridge of Face Equality. And he talks about three things that happen. And one is the language of pity. Oh, you poor thing. How did you live your life like that? Or why don't you just get it fixed? That's we're normal and you're not, and you need to get it fixed type of language. And then there's the language that you're a superhero. Everything that you do is amazing. You're inspiring and you live this life that's so inspiring when sometimes you haven't done anything except for that you were born, and maybe born with the cleft. So consider that language. The doctors often use words like repair surgery. We're going to give her repair surgery, and she's going to be fixed, and she's going to fit into society, and she's going to be able to pass a supermarket test, and the first day of school test, and the first bus ride test, and the first day of her employment test. And that kind of language tells anybody that you're different and you're othered, and we just want to be the same as everybody else, nothing different. And so there's, the language needs to, the language is important, especially around a developing child that's learning their own self. There are a lot of words, defect, deformed, birth defect, abnormal, different types of language like that. It all stigmatizes the child. So that type of language is something that needs to be considered.
Absolutely. And how have you responded when you've heard it, Marley?
When I was younger, I just internalized it and I became angry, and I spoke about this a little bit earlier. I didn't really know how to react to it. I didn't understand why somebody would think that was okay to talk to me that way. As I've grown and matured, when I hear people use words like repair surgery, I automatically say that, no, I like to refer to that as initial lip closure, or I like to refer to that as my initial palate closure, because that keeps the language very neutral. If I hear maybe a surgeon that is having a presentation to parents and speaking about their children and the techniques, the skilled techniques that the surgeon has developed over the years. The surgeon has spent lots of time developing these skilled, delicate techniques that they have to do, or that they do for the child. I will say, your words are just as powerful to that child as any surgery that you did. Sometimes we forget that part, and words are really important. So I will write a letter. I've written letters to the surgeon and just explain my story and why, ask for their commitment to change the medical narrative around a developing child, because I think it's really important.
And that goes back to advocacy, which you've been kind of pumping up all day about. You have to advocate and teach. If they don't know, and sometimes the doctors, they really don't know. They don't know how we should be addressing each other. And so they know now when you say to them, I would like to be referred in this way, and they can do that for the next patient. So it's great that you speak up and you do that. And so for Morgan, we know that you are a mother, very proud mother, but you also are a speech and language pathologist, as we saw in the last session. What are some ways that professionals like doctors, teachers, and even media creators can shift toward more person first and empowering communication.
Yeah, everything Marley and Christine said, but I think modeling it for ourselves so that others can hear. And I even find myself when I'm talking to my graduate students or whoever in the community, if I say cleft repair, I'll catch myself and I'll say, oh, nope, sorry, I meant palate closure surgery. So I think being transparent and being vulnerable and being okay to say, oh, see, I did it too, I think is pretty empowering. And I think it sticks with people when they hear that.
Absolutely.
Because, we make mistakes too. So I share that with my students. And I think it's important to correct, like, in the moment, because you don't want to let it go by too long.
Absolutely.
And then it loses its effectiveness if that's the case. So speaking up and just saying, hey, it's actually, I like, to be referred to as cleft of palate closure versus repair. It's nothing that's broken.
Nothing
It
is
just
broken.
didn't close.
And nothing is broken, and none of us are broken in this
Right.
room, and so the words that we say around it are very important. And so I know everyone in the audience is wondering, how can they correct or educate others when outdated or insensitive language is used? And anyone can jump on that question.
I like to use a 3-step approach that I've learned works really well. And the first is that whenever somebody uses, I guess, unwanted words with me or to describe my cleft or anything like that, I first acknowledge the intent. I'll say something like, I know you didn't mean that the way it sounded. And then I'll model the language. And I say, but we try to avoid saying birth defect, or we try to avoid saying, any of the words deformity or anything like that. So I acknowledge that, say, okay, here's what you said. I know you didn't mean it to be hurtful. Here's what we say instead. And then I'll explain why. Say something like, it's better to say birth defects. It's better to say, like Marley said, lip closure or palate closure. And that way it takes that moment to teach them, here's the correct language, here's why it's not helpful, here's why it's harmful. And I think that going forward, we need to kind of take the responsibility to keep educating. Because when most people use what we deem as negative words, they just don't know any better. They haven't been educated. I've had many discussions this weekend about the use of the H word among older generations and older people with a cleft who said that's all they heard growing up. I cannot tell you the number of doctors that use that word to refer to my cleft, and so much that that's how I used to refer to it until I met a lot of other people in the community and realized how hurtful it was to them. And so we have to also think of the intent behind it, but taking that 3-step approach really goes a long way in just educating, keep raising awareness, keep educating around cleft to break down that stigma.
Marley or Morgan?
I would say that, as a person born with a cleft, and I think we spoke about this a little earlier today about the media, we're erased from the media. There's a handful of people in the media, in the movies, on TV, that we see that we're born with a cleft, and representation is really important. So I really appreciate that conversation earlier today, because when you see somebody else doing something, you know that you can do it. It's like the Mary Tyler Moore effect, and I might be dating myself here, but when she decided that she wanted to be a news anchor, all of a sudden, all the women in news, the population of women in news went up. So when we see representation, we know that we can do really powerful things. Also, I think it's important to listen and apply what a person born with a cleft is looking for. Listen to their story, listen to our stories, and then apply what we have to say. And then one thing I notice is that many scholarly articles, I read scholarly articles just like a hobby, do not, especially in the United States, they do not include the voice of the person born with a cleft. So we need to have the voice of the person born with a cleft included in scholarly articles, and then listen to what people are saying. Use first person language. You know, I was born with a cleft. I'm not a cleft person, right? And words do matter. That's
Thank you. Morgan, you have anything to add?
Other than just reiterating back to correcting in the moment,
Okay.
because that's where your momentum is. So using that first person language in the moment, and yeah, that's what I would
Okay.
say.
Absolutely. Because you only have one chance with that person. You never know that you may not get that second time
Right.
around to come say, hey, this offended me, or this is how you should have said it. So you have to take it in that moment. And I think, I can't remember exactly who said it, but your voice might be shaking when you say it, but still just say it. And just so that person can be aware, because then that will spread. And at least you know, I did that for me.
Right.
And for the other cleft affected person that comes behind me, I did it for them as well. And they'll think twice about how they reference them.
And people don't know what they don't know.
Exactly.
Right?
Don't
and
know
so
what you don't
when
know.
you don't know, then you know
Yeah.
by saying something, and then the hope is that that person does better.
Absolutely.
So that's the hope.
Absolutely. And I see that we're getting down on time. So for my last question, if you could change one thing about how the cleft and craniofacial community is talked about or represented, what would it be?
Well, I would definitely change it from appearance to experience and identity. Right now, the narrative is on fixing our face. Yes, I know he used the word fix. That's the negative term, is to fix our face. Well, what about when we have to face the world? And so change that narrative from empowering us and getting us stronger and enhancing the resiliency that we have to get through all the surgeries, to get through the stigma that society shows us. And we can use that with humor, with the advocacy that we're all doing this weekend, by building those relationships. And I say, let's use positive words to showcase the accomplishments that all of us with a cleft have done. I mean, we have so many professional people here who have done so many great things, and as a community. So I think that as we go forward and get the word out, continue to get the word out, that's going to start to change things. I also think that we need to make sure that our representation centers on our humanity and not just our appearances. And that goes for no matter what the appearance is. It goes beyond medical chats and medical charts, because that's where the real humanity is. And I always like to tell people when they ask me about my cleft and how it affected me, I say that I was born with a cleft, but I was not born broken. And it took me a long time to realize that I was not born broken, because I thought for the longest time I was. And so what really broke me were the words that were used, from the doctors especially. When the doctors don't talk to the patient, no matter how old that child is, no matter how old you are, it left me out of my own care. And it made me feel like, oh, I'm even more broken, because now they're talking about me and not with me. So parents, include your child. I know that some of you have had that discussion this weekend, how to tell your child. Tell them, no matter how old they are, you know what they can accept, you know what they can comprehend. Just tell them, especially for doctors, providers. Even tell your doctors and providers to talk to the child as well, because that's going to make all the difference in the world.
Absolutely.
Yeah. Give them the CCAC brochure. Put a plug in for that. Mine's very simple. Nothing about us without us.
Absolutely.
So we're we need to be in the room where it happens, no matter how hard we have to push for that. So.
A little Hamilton plug, huh?
Yeah.
Boy, those are pretty powerful statements. I thought we should just end on that.
Okay.
You have the power to change the stigma, and you know the parents in the room and the adults born with clefts, and you know everybody in this room has the power to change it. And I think we really need to listen to the words that are said about our children, about ourselves, and it's okay to push back and not accept it. You know, we were not born broken. And that language does not need to be used about us. And it's okay. You don't have to be rude. it's correct in the moment. And when I do that, at times doctors, I know that they will have to think about the words that they chose the next time it just rolls off the end of their tongue. They'll think, they may not be perfect, but they're going to think about changing the language. And so it's okay to say that. And I think I'll end on that one.
Beautiful. And when you talked about using your power, each one of you uses your power as being part of the CCAC. And I want to go ahead and announce that the CCAC is currently working on our language guide, and you all have put in your input, and we'll be putting in your input on the final version of that, and so is the CCAC members that are here. So it's like we are making that change and making sure that we are represented in the right way and how we want to tell that story.